I'm Dr. Himani Khanna. I'm a developmental pediatrician, a co-founder and a director at Continua Kids. Today we are making this video on the topic for today is anxiety in children on autism spectrum disorder. We all know that our children on autism spectrum disorder face a lot of fear and anxiety. So nearly the research says 40% of the children can have this as a coexisting challenge, and sometimes it can exist as a comorbid condition also for a very long time. So now, what is it that causes anxiety in a child on autism, and how do we manage it? So anxiety can be caused because the child is finding it difficult to socialize, to interact with a peer, is not able to communicate what the child wants or wants to express. The child gets frustrated, and every time he needs to make a communication, he starts feeling anxious. Sometimes the child also has some certain sensory sensitivities, and when he or she gets exposed to those sensory sensitivities, the child starts feeling much more anxious. If the child is made to transit from one activity to the another, from one person to another, or from one area to another, any kind of a transition can put the child in a very anxious state. Then accepting changes is very difficult for the child. So when the child is exposed to changes, can put again the child in a lot of anxiety and fearful situation. So when a child is fearful, it is all the more difficult for a child to undergo any kind of a skill development, because the child is so fearful, is just simply so anxious that the child will not be ready to learn a new thing. So there it's important to allay anxiety for the child. Now, how can we help our child undergo these transitions or these abrupt changes that causes anxiety? So here first thing is, do not expose them or minimize the abrupt changes happening for them. Use various environmental strategies. For example, if the child is very sensitive to certain sensory stimulus like a loud sound, you can use a headphone. If you're traveling out and you feel that your child gets very restless and anxious the moment he gets exposed to a bright light, you can use a pair of goggles or a cap when you travel out, so that that instant abrupt change or that sense exposure to that sensory stimulus is not there, and the child does not land up in an anxious state. Now, when it comes to social interaction, there is a lot of fear and anxiety that a child experiences whenever he has to approach another adult or another child of the same age group. In that case, we can have small play groups arranged for the child, or play dates where there can be Lego clubs introduced to children. There can be some kind of a small play dates where 2 or 3 children are invited and they are playing. Even if they're playing on their own, at least the child starts getting acclimatized or used to the surroundings of having children around and does not feel anxious. So slowly exposing them to a social scenario and then incorporating a social scenario or a structured group activity for the child can really help allay their anxiety in a social scenario. So experiential learning is a very good technique which can really help the child, and let's assume that the child needs to go tomorrow to a birthday party. So how do we prepare the child? So we can expose the child to balloons, to a cake, set of candles, blow them, practice them, expose the child, prime the child with the kind of activities which happen in a birthday party. Family members all collect around the cake, they are all singing the birthday song, and when you expose the child beforehand, you can blow balloons, you can expose the child to the texture, to the sound, and certain bursting sound of balloons also. So if a child knows, okay, the birthday celebration is this environment, he has experienced it once, the amount he or she is much more prepared for a similar scenario the second time, and the amount of anxiety will be much lesser. Now, a very important factor which can contribute and lead both to the anxiety is that if a child wants to communicate something and is not able to do, the child starts feeling anxious. And at times what happens is, because of the anxiety, is not able to speak. So it is not just a factor which is causing anxiety, but it is also leading to anxiety. So how do here it is very important that we try and teach the child to communicate. A lot of time parents come and say, oh, we don't want to use sign language, or we don't want to teach our children gestural communication, because once he starts making gestures he will not speak at all. But here you have to understand that the amount of anxiety that the child has because of difficulty in communication will come down. The child will be relaxed much more and will be much more prepared to learn verbal communication as well. So it's extremely important that we work at teaching child certain communication skills. Encouraging a child always motivates. So encouragement is very, very important. Whenever a child is transiting comfortably from one situation to another, you must encourage the child. Use a lot of positive words. You can use a reward policy also when you find the child being able to work in or is able to execute things or is able to tolerate the change well. So reward policy, distraction can help at times. When you're not able to handle the situation, you can use distraction techniques to reduce the child's anxiety. Then it's important for us also to teach our children to be able to express their emotions. You can use a visual chart of emotions and teach your child what is various emotion looks like and how the child is feeling. Right, I'm feeling happy, so show a happy smiley. If I'm crying, I feel unhappy, I'm sad, you can have different smileys or different faces with that expression and teach the child to connect their emotion with that visual chart, and every time he feels in a certain way he can show the chart and also tell. And lastly, to conclude here, I would say if the child continues to stay anxious and has excessive fear, which is interfering in his day-to-day activities, interfering in his learning, you can seek support from your healthcare professional who's managing the child. They can definitely add some pharmacotherapy or medications to reduce the symptoms and help the child. Thank you, and hope I added value to today's session. Thank you.